can save it, right? I mean, it's recording. Okay. So good morning, Aushi.
Good morning, Diana.
I will introduce myself and then you introduce yourself. So I'm Diana and I'm an Ayurvedic enthusiast. So I have been always into Ayurveda since a young child by my grandmother. And we share similar path as well in this Ayurvedic, path. So I will let you introduce yourself and then we will talk, during the video more about who you are, who we are maybe, and share experiences.
Okay. Thank you, Diana, for having me and inviting me to speak with you. So my name is Dr. Aushi Patel. I'm a holistic dentist. I've been practicing about 27 years. And alongside my dentistry, I, just like you, Diana, have always had an interest from childhood, gifted to me from my grandmother as well, an interest in Ayurveda and, ancient healing techniques and, particularly plant medicines. We've had many in-depth discussions about the power of plant medicines. So my daily work in my dental practice, I've been practicing holistically for many years, and recently, during the pandemic, I decided to go and study Ayurveda formally, and I got my certificate in Ayurvedic healing so that I could actually integrate more of that into my daily dental practice. And so today, really, I wanted to, just kind of bring some more awareness about the mouth and how important it is. Obviously, we know that mouth has, performs many, many important functions. We nourish ourselves through that, through our food and our drink. For some people, it's the organ which they breathe. It is how we speak. It is how we are communicating now. So it is, one of the most used parts of the body, actually, Diana. And
yes, it is.
Beyond those important functions, the mouth is extremely, intimately connected with the rest of the body. And I would like to bring more awareness to, the world about this when we look at, our overall health. And I say to my patients, if you want to be healthy, you really have to, look at the mouth and make sure that is healthy, because if your mouth is not healthy, your body will not be healthy.
Yes.
The mouth is the first part of the gut, and we spend so much time, a lot of effort, a lot of education around looking at the gut microbiome and how, a great proportion of our immune system is located in the gut, and how these bacteria in the microbiome play such an essential role in our overall immunity and our health. And the first part of the gut is the mouth. So
yes, it is.
We swallow about 2 cups of saliva a day. So whatever is going on.
When we were talking, the other day, I was like, okay, 2 cups, I know some stuff about the mouth, but 2 cups of saliva, it was like,
Absolutely. It's a lot,
Go ahead. Yeah.
And whatever is in our mouth, is it an area of toxicity, can be swallowed and enter, the gut microbiome. And what we do know now, and a lot of research is showing that the mouth has its own oral microbiome as well. So, and another way that the mouth is so intimately connected with the body is through its rich blood supply. So, if you look under your tongue, you will see a lot of blood vessels. It's a very rich vascular area, and this is why homeopathy drops are placed under the tongue. For people that have angina and develop heart pain, the medication to relieve that heart pain is squirted under the tongue, simply because boom, it's straight through, you know, in the bloodstream to the heart. So
Yes. Yeah.
whatever is in the mouth can also be absorbed through the gums into the bloodstream and
Yeah.
can circulate all around the body. And these days we are discovering, you know, through a lot of research that oral bacteria can have far-reaching effects on the body, you know, in terms of it's connected to a higher rate of heart disease,
Yeah.
Alzheimer's, fertility issues. So
Yes, even Parkinson, I have read one time, you know, I
yeah,
read that it was about, and I remember I told you that I was talking to a cardiologist the other day, and he told me that um, even people that have like a very bad oral, habits, they can have heart diseases like strokes or heart diseases in so many ways, you know. So everything is linked anyway to
absolutely.
our mouth. Yeah.
Absolutely. I mean, there's a digestive issue called leaky gut, you know, that people
Yeah.
can develop, and you know, through that, toxins and undigested food particles can get absorbed into, you know, the bloodstream. And
Mhm.
I say to my patients, you know, leaky gums is a similar thing, you know, where we can, you know, if the gums are
It's leaky
inflamed.
gums or gut.
Well, we have leaky gut, but leaky
Yeah.
gums can also, you know, if your gums are inflamed,
Yeah.
you know, we are also absorbing those toxins into our
Yes.
bloodstream. And that is the
Yeah.
link to, you know, conditions like heart attacks, strokes, Alzheimer's. We're also
Yeah.
finding, you know, through the gut connection that a lot of the oral bacteria involved in gum disease are being found in distant sites where colon cancers are developing. So,
Oh. Wow.
you know, the mouth has a big impact, and whatever is going on in the mouth, you know, can affect other parts of the body.
Yeah.
So, you know, between that and also, you know, types of toxins that we can have in our mouth as well from everyday dental procedures, you know, mercury amalgam can, you
Yes.
know,
Yeah.
be in the mouth. You know, fluoride can have potentially, you know, harmful
Yes, this we will
effects.
discuss in another video so that people can,
Absolutely.
you know, have awareness how dangerous like fluoride is for the dental care, you know, for the whole system actually, and the spiritual
Absolutely.
connection as well. We will discuss in another video.
Absolutely. Yeah. And, you know,
Yeah.
to look at our diet, you know, and natural ways where we might try and prevent decay, you know, opening up the
Yeah.
window to see that.
Mm-hmm.
And also, you know, the toxins that, you know, are present in our everyday oral care products, Diana.
Yeah. Yeah.
Many of
The
them, you know, contain harsh chemicals which can wipe out
yes.
all the good and bad bacteria in the mouth.
Yeah.
And what we know now about the oral microbiome is it's not about wiping out all the bacteria in the mouth when we you know, go through our oral care routine.
Yeah.
We want to maintain that balance as we do in the gut, you know, of good and bad bacteria. So
Mm-hmm.
many of the, you know, oral care products, you know, that are around can actually strip the microbiome and, you know, create an environment in the mouth which is going to, you know, lead to more issues and disease.
Yes,
So
because I mean, humbly, I mean, I'm not a doctor, but what I think is that it's irritating, and the mouth, you know, just self-defense. It's the self-defense of the mouth, and they just produce like other stuff, and you have those bacteria that are staying in the mouth. Is it like we can logically think about this, like the mouth is self-defensing when we put harsh chemical things in the mouth, like products?
absolutely, you know, and the mouth is the
Yeah.
gateway to the body. So,
Yeah.
for example, you
Like
know,
we
if
say the soul to the, you know,
eyes
temple
are the
to our
wind,
body, but
eyes are the window to the soul, and the mouth is the
yeah.
gateway to health. You know,
Yeah.
and you know, when we look at ingredients like alcohol in mouthwashes, you know, that has a
Mhm.
drying effect
Yeah.
but it also strips all the beneficial bacteria, you know, that we need to promote the health as well. And
Yeah.
you know, these days a lot of people have dry mouth as well, and saliva
Yes.
actually does contain immune cells that protect us from, you know, invasion from the external environment.
It's a
because
barrier. Yeah.
it's a barrier, because it's the interface, right? Our
Yeah.
mouth is, you know, the next step before, you know, the external environment. So what we breathe, what we eat, what we drink,
yeah.
everything
I
has
always
to.
refer that, sorry, I always refer that to the, you know, the corals barriers, you know, before the waves come, and there's like, you know, or else it will be like not calm sea everywhere. So we have these coral reefs, you know, even in
Yes.
Australia you have that. So it's a barrier, and so the saliva will protect as well. And I have seen that people that are lack of saliva, they have bad breath. Why? Can you explain why?
Okay, so bad breath, Diana, I believe, look, it can be from oral hygiene, but generally there can be an underlying gut issue as well. Like, once again, remember, it's one tube. So in Ayurveda, as we say, it's amma buildup. So if we have a gut issue, undigested food, toxins building up in our gut, that will come up and cause bad breath, and dehydration as well. Dehydration. Okay. And also, if we are breathing through our mouth, which many people do for many reasons now, or develop dry mouth. Many medications cause dry mouth as well. It's a common side effect of many of the everyday prescription medications. So the saliva is the washing, is washing our mouth. It's
natural.
It's the tide, you know, it's cleaning our mouth constantly. Now, if we have a dry mouth, it becomes a bit like a stagnant pond then. So the toxins that build up, that can come from our gut, and also the oral bacteria. And the mouth also then becomes more acidic when it's dry. So when it's acidic, because saliva actually alkalizes our mouth. Saliva is alkaline in nature. Its pH is alkaline. So when our mouth becomes more acidic, the harmful bacteria start to grow. They start to, you know, become more dominant. And these then release toxins, which can also, you know, sulfur producing. So, you know, when patients of mine come in and, you know, talk about bad breath, first, you know, I discuss what's going on with the gut. But then also, you know, look towards some Ayurvedic practices.
You do your practice in a holistic way, right? Because
absolutely,
there are, if dentists, you know, other dentists are listening, like they said, okay, Dr. Aushi is asking about the gut, and so it's in a holistic way, in a more like natural approach, right? Even
absolutely, because. You know, the mouth and the gut are one, you know, it's just one tube really. And this is the top of the stream. So what's going on here can have a big effect. And we know there's that reciprocal effect now.
So what do you ask your patient then? You ask about the gut, how, you know, how they eat, or what do
generally? So my intake form, I do ask about gut issues. So, you know, things like candida, leaky gut, SIBO as well is another one, which is small intestinal bacterial overgrowth. Did I say leaky gut? Yeah. So things like that, even reflux as well, can affect the mouth. So people that mouth breathe at nighttime can have acidic fumes coming up through the gut at nighttime, Diana, and that can make the mouth more acidic. So this is a whole big topic that I'm sure we can discuss.
No, we're going to come back in other videos, so that, you know, each and everyone can understand how it's important, the mouth. I mean, everybody's talking about Ayurveda, Pitta, Vata, Kapha, but nobody's talking about the mouth, which is like extremely important. Everybody's talking about the food, but nobody's talking about, you know, where you put the food in the storage.
Exactly. What's going through the mouth is very important, but what's in the mouth, maybe, you know, a little bit more awareness. And, you know, what I'm very passionate about is, you know, looking towards Ayurveda and, you know, the ancient wisdom that has remained unchanged for thousands of years.
Yes,
you know, these practices
have
been...
But one thing I want to add is we have to evolve with our era, with the time we are living in. It hasn't changed, but we have to live in the era we are living, because we are not living in the time where, like, our sages in India, you know, they were planting, growing. Everybody don't have, you know, this opportunity to plant, grow, and, you know, so the food is different. So it hasn't changed, but we have to live, you know, with this era.
Absolutely.
So
and time, you know,
yes, time.
For example, when I talk to my patients about oil pulling, you know, 15 to 20 minutes can feel like a long time. And look, personally, in my morning routine, I can do 5 minutes, you know, and that's better than nothing.
Better 5 minutes than nothing.
You know, and I say to patients, we are not living in, you know, the villages or, you know, in rural India, you know, where the day,
everything we have to rush.
I mean, we're living in a Vata era today. You know, it's about speed, it's about emails and, you know, work,
running
and running busy, you know. So we must adapt. And you know, I think there is a lot of wisdom and, you know, treasure in ancient Ayurveda that can support oral health, you know, and it's not meant to be a substitute for going to the dentist.
No,
you know, we can't heal a tooth with, you know, herbs and plant medicines.
Yes, but if there's we need to explain that if there's a decayed tooth, and we can't just say, like, as I was saying before we started, you know, we can't just put a clove, because clove is very good for them, and just wait and see, like, by miracle it will happen. But the thing is, what you are bringing awareness today is to prevent that. And if we prevent, we don't have to go and get, you know, our teeth taken out, you know.
Absolutely.
So this is the main reason, Aushi, that we are here today, and you are here to explain how we can prevent, right? So you were saying that, you know, it's not about a substitute.
Not a substitute at all, no. You know, it can be a supportive, you know, a supportive part of your oral care, you know, and, you know, I think there's some areas where Ayurveda because I think the importance Ayurveda places on gut health, that the mouth has got a significant, you know, place in overall health when we, you know, look into Ayurveda, you know.
This is where the tongue is checked as well.
Absolutely.
Like, you know, when you go to the doctor, Ayurvedic doctor, they check your pulse, your tongue, and they ask you about your bowels, and they ask you how you urinate and all this stuff. So if you think, you know, just hard, everything is going inside, you know, everything is all the health we need to take care of inside, but we have to take care of what we eat as well. Because when you wake up in the morning, if you had like an excess, for instance, you know, everybody had an excess, like going to a wedding and eat a lot, and especially Indian weddings. So, or have taken alcohol or whatever. I'm not encouraging people taking alcohol, but I'm giving examples, right? So when you see the tongue in the morning, there's a thick coat on it. See, there's a thick coat on it, and this is where all the toxins are, you know, people, they are detoxificating. This is what you say, the liver. But the tongue, they are forgetting.
Absolutely.
You know, they don't clean the tongue.
Clean the tongue, you know.
And now they have this brush that you can clean the tongue on the backward of the brush. But all the bacteria in in the brush itself. Some people, some of my clients, for example, they just brush the teeth like this with a toothbrush. But there are bacteria that you can talk about this. There are bacteria on the toothbrush. But comparing to a tongue scratcher or tongue cleaner,
Yeah.
I mean, it's in copper mostly, and it's, copper is antibacterial. So, people
Absolutely.
in rural India, they keep water in copper and they drink when they wake up in the morning, and it has a lot of beneficial, it's very, I don't, how do you say, it has got a lot of benefits. So can you just explain how like taking care of the tongue? Maybe we'll come in another video, but the thing I was talking about, the coat, the ama, this, when we do excess,
Absolutely.
if we keep it on the tongue, what happens next?
Well, when we are sleeping at nighttime, our digestive organs are detoxifying. During the day, they are working, they are in the office working. Yeah. And that is why, as per Ayurveda, we say, not to have a big meal before bedtime.
Yes. Yeah.
So at night, when our organs are detoxing and rejuvenating, they release toxins into the gut. Those toxins, known as ama, travel up through the mucus lining of the gut and deposit themselves on our tongue overnight.
Yes.
Now, if we wake up in the morning and we kiss the person next to us, or we go and eat breakfast or have our coffee, we are swallowing or sharing, and sharing is not caring in this situation. We are either retoxifying ourselves or passing the toxins.
Badly, because it's not only that you're putting something that is toxic, it's super toxic, because it's I mean, it must be disgusting, the thing that I'm going to say, but when you go to toilet, you leave all your things, that the waste, and this is the waste on the tongue. So you have to clean it. It's the waste that you don't want to swallow your waste, right? And you have to clean it. And this is coming nowadays, but it's more fashionable if you do tongue scratching. It's not fashionable. It has been existing like for 5,000 years. So, it's extremely important to use this accessory, like cleaning your tongue, for your health, for a better health. It's not, I use like, nowadays you do yoga, you're in, it's fashion. You do Ayurveda, it's fashion. You do mantra or tantra or anything about it. We can talk about this next time.
Yantra, yes.
Yantra. All the tra are in,
Yes.
So but mainly nobody focus on, I have not seen anybody since now. I mean, I have not read anything that you have to take care of your mouth. So it's the waste that we have to get it out, and then take new things in our mouth, and then it's called nutrition, or else it's called toxifying your body,
Absolutely.
because or else you can eat organic, you can eat like farm growing or whatever, what next, anything new, but you're still eating waste because it's mixing with your food. You can buy the most like pure tomato, but you eat it, you're eating waste with it. So this is where we have to be conscious about.
Yeah, I think, look, Ayurveda, has an emphasis on looking at your tongue and getting, being able to assess your tongue and get an idea of toxicity. Of course, that doesn't replace going to the doctor if you're unwell.
No, we are not saying that. No.
Also, the practice of tongue cleaning, as an Indian, I'm not sure about you, Diana, but I grew up, it was never an option of, I mean, it was just.
I grew up with that. It was there, you had to use it.
I mean, the minute you got out of bed, you could not do anything unless you went and tended to your mouth, and tongue cleaning.
And you know what, when I started to travel to Western countries, and then, you know, sometime I'm invited somewhere and everything, I will brush my teeth and clean my tongue first before going to breakfast. And I did, you know, there are these questions that came. I mean, you know, why do you brush your teeth before eating and then you have to brush it again? You know, it's like, but then you have to explain to people why, because they feel it's strange. This is what they are used to. And how you were saying, Aushi, I mean, I grew with that. The tongue cleaner, the toothpaste and the brush was there. You had,
Always.
you know, they were there. You had to use it. You know, it's like you have to use it. And so this is where we have really to explain the importance, because sometimes people, they don't understand why you're brushing your teeth before going to breakfast. It makes no sense to them. You get up, you go take your breakfast, you know. But if one day this happened and you have started cleaning your tongue, and then you go take breakfast, and then another day you don't do it, you can feel the difference.
Oh, absolutely. Yeah.
You know that the tastes are different when you remove this coat of ama, like the thick paste on it. Yeah. When people, they, you know, they get the tongue out and they show their tongue, there's this white thing on it. And the more it's white, the more it's, you know, they have to take care of this tongue, not the going to buy, like, I don't know, artichoke, how you call it, like this artichoke to detoxify the liver. But they need to take care of this tongue. Absolutely. So it's a very important practice, especially the tongue cleaner should be in copper, because there are meaning. We can come after. I can talk about the astrological, you know, because I'm an astrologer. I didn't introduce that. Mm-hmm. And we can talk about how copper is important for our immune system and what is linked to So go ahead, Aushi. Maybe we won't, you know, make this video long. We can come back with other topics. Yeah. Where we talk about the brush, a topic on the tongue scratcher, and we can come about, you know, like oral care, oil pulling, because now people are doing, because it's like yoga, same thing. Yes. It's fashion. They do it. One thing is, I was talking about with you yesterday, is like oil pulling can be, you know, time consuming. This is true. But you have to have the proper, like, product, because I have bought like some oil pulling, you know, where you have to take with your spoon and put in the mouth, you know. I think it should come in a tube, like people, you know, just like this, or squeeze it, a practical way. Because I have some, like you have, or only the coconut oil, you have to take your spoon, and, you know, and then after you have to go and rinse the spoon, and everything needs to be like clean, and we have to rush in our day. And if this practice becomes something like too much time consuming, people won't want to do it. Yeah. You know, so even 5 minutes is important, better than nothing, as you said. But oil pulling as well, we can talk about it next time. Yeah. About toothbrush, which kind, like, which, you know, kind? Electrical or manual. And yeah, do you have something else to say to end this video?
Yeah, look, we'll also go into all the different plant medicines available, you know, yes. All the, you know, ancient herbs, spices that are everyday kitchen, you know, spices that can be used to support, you know, I'd love to share a lot more on that, you know, as we are both plant medicine.
No problem.
Soul sisters there. Yes, we can talk for hours on that, the alchemy of it all. But we will definitely do a video on, you know, the power of botanicals to support oral health, and you know, backed up by, you know, modern day research. You know, there's more and more research showing.
We have to explain to people that modern research are, you know, that evidence.
So yes, stay tuned, and we will do more.
We'll do more. So anything else you want to add? Like, it's you know,
I think that's
because
it.
I have cut you when you were talking, like, I was I interrupted you about the we were talking about alcohol, how alcohol was, danger for the mouth. Even alcohol, we put it on the skin, and people have to bear with us. It's our first video, in Ayurveda, so it's a mixture of, but we
Oh,
will come
yeah.
back much more structured next time.
Yes,
It
yes.
has been, I think, a little bit structured, but I'm all over the place. When we talk Ayurveda, it's like,
I know.
you share this example and example. So what people don't think is, like, they say, don't put alcohol on your face. Loads of products, beauty products contain alcohol, and it's a danger for the skin. It's our
Yes.
largest organ. But you were talking about alcohol, how it can affect the mouth. You say it's dry.
It
It
dries
dries
the
the mouth.
mouth,
Yeah.
and
Yeah.
it can just wipe out all the good and the
Yeah.
bad bacteria in the mouth. So,
Yeah.
that just sets the mouth up for disease then. So
Okay. Perfect.
we'll talk about
We'll talk
some
about
natural
this next
alternatives
time.
for mouth cleaning as well.
Yes, we will.
Mhm.
And thank you so much, Aushi,
Thank
for
you,
your time in
Diana.
Australia. Me in France, we had, to connect.
Yes.
And so let's come, with other videos. And so that our main thing, our main purpose, we talked about it, is that to bring awareness and explain to people, especially in India. Nowadays, people, they are doing completely different. That's what they have. They have so many plants and everything. So we have to explain to them, because they are, maybe focusing more on how here we are living in the West. And this is evidence. People, they just tell me, I mean, what is Ayurveda? People from India, Kerala, what is Ayurveda? What is this plant and this plant? So we will bring back, this ancient knowledge, wisdom. I know very like this, we always keep it, we will always be learning. I mean,
Yes. Yes.
it's the same case for you,
Yeah.
Aushi. So we will bring this awareness about plants and Ayurveda and all this stuff. Maybe one day you can share about other stuff than mouth, experiences and
Yes.
stories. Yeah, so that people
Would
can
love to.
relate to. Yeah. Thank you so much.
Thank you,
Let's talk
Diana.
next time. Have a good
Okay.
time in Australia
Thank you.
and talk soon. Yeah.
Thank
Bye bye.
you.
Thank you.
Bye-bye.
Bye bye.
Thanks. Bye.